Difference between counselling and psychology. Counselling and psychology can both support emotional well-being, but their qualifications, services, and professional roles are different. Counsellors often focus on coping, relationships, and emotional support. Psychologists may provide assessment and structured therapy. The right option depends on the participant's goals and needs. What is NDIS counselling? NDIS counselling may help participants build practical, emotional communication and coping skills linked to their disability-related goals, supports emotional regulation and self-expression, builds confidence and self-advocacy skills, helps participants manage relationships and conflict, supports adjustment to disability-related changes, encourages greater social and community participation, should focus on functional and measurable outcomes. What does an NDIS psychologist do? An NDIS psychologist may support participants whose psychological, emotional, or behavioral needs affect daily functioning, provides evidence-based psychological therapy, supports emotional regulation and coping skills, may conduct psychological assessments, examines barriers to daily and community participation, may prepare progress or assessment reports, can collaborate with families and other providers. Counsellor versus psychologist. Qualifications in Australia. Psychologists and counsellors follow different qualification, registration and professional accountability pathways in Australia. Psychologists must hold current AHPRA registration. The title, psychologist, is legally protected. Counselling is generally a self-regulated profession. Counsellors may hold professional association accreditation. Participants should check qualifications and disability experience. Relevant skills matter alongside formal credentials. Does the NDIS fund counselling and psychology? The NDIS may fund counselling or psychology when the support relates to disability, goals, and functional outcomes. Funding is not automatic for every participant. The support must meet current NDIS funding criteria. Therapy should relate directly to disability needs. Goals should be clear and measurable. The provider must be appropriately qualified. Mainstream health services may cover unrelated clinical treatment. Which NDIS budget covers counselling or psychology? Counselling or psychology may be included as a therapy support, depending on the wording and structure of the participant's plan. Check whether therapy is listed as a stated support review, available funding before booking sessions. Confirm how the support relates to plan goals. Check whether reports and travel are charged separately. Plan management arrangements may affect provider choice. Ask for clarification when plan wording is unclear. Check your NDIS plan carefully and confirm the funding category, service limits, and extra charges with your provider before starting counselling or psychology sessions. When might counselling be more suitable? Counselling may suit participants who want practical support with emotions, relationships, communication, and life changes. Managing disability-related stress and adjustment, improving confidence and self-advocacy, developing healthier communication strategies, strengthening relationships and personal boundaries, building coping skills for everyday situations, supporting social and community participation. When might psychology be more suitable? Psychology may be more appropriate when a participant needs assessment, complex intervention, or formal psychological reporting. Psychological or cognitive assessment may be required. Needs may involve several interacting concerns. Therapy may require structured clinical intervention. Formal reports may be needed. Significant emotional barriers may affect participation. Multidisciplinary collaboration may be helpful. Counselling versus psychology for different support needs. The most suitable service depends on the participant's goal, level of complexity, and whether assessment or reporting is required. Both can support emotional coping and communication. Counselling often suits adjustment and relationship goals. Psychology may suit complex psychological needs. Psychologists may complete formal assessments. Counsellors can document progress within their scope. Provider experience and therapeutic fit remain important. Can counselling and psychology be used together? Participants may use counselling and psychology together when each professional addresses a clearly different goal. Each provider should have a defined role. Services should not unnecessarily duplicate each other. Goals and outcomes should be documented. Providers may collaborate with participant consent. Progress should be reviewed regularly. Funding should be used for clearly justified supports. How to choose between a counsellor and psychologist. Choosing the right provider starts with identifying the participant's functional needs and expected therapy outcomes. Define the everyday difficulty or goal. Decide whether formal assessment is needed. Review the participant's NDIS plan. Check qualifications, registration and experience. Ask about therapy methods and reports. Consider communication style, accessibility and participant preference. Questions to ask an NDIS counsellor or psychologist. Asking clear questions before therapy begins can help participants understand the service, fees and expected outcomes. What qualifications or registrations do you hold? What NDIS and disability experience do you have? How will therapy support functional goals? How will progress be measured? Can you provide the required report? What are the session and additional service fees? How do you work with other providers? What to expect at the first appointment? The first appointment helps the participant and provider understand current needs, goals, and whether the service is a good fit. Discuss disability-related challenges and strengths. Review NDIS goals and previous supports. Identify communication and accessibility preferences. Explain privacy, consent, and confidentiality. Discuss appointment frequency and fees. Agree on practical therapy outcomes. Ask questions about the provider's approach, counselling and psychology through telehealth. Telehealth can make counselling and psychology more accessible when online appointments are suitable for the participant, reduces travel and location barriers, supports continuity of therapy, may suit participants outside major cities, requires reliable and accessible technology. A private space may be needed. Emergency and technical plans should be discussed. Face-to-face support may still be more suitable for some needs. Which should you choose? The right choice depends on the participant's goals, required professional expertise, and the type of support needed. Choose counselling for coping, adjustment, and relationships. Consider psychology for assessment or complex intervention. Check provider qualifications and relevant experience. Review funding and plan wording first. Consider communication style and therapeutic fit. Keep participant preference and choice central. Speak with Affective Care. Affective Care provides psychology support for children and adults, with a focus on disability-related goals, emotional well-being, and everyday functioning. Face-to-face appointments are available in Sydney, while telehealth options may be available across Australia. Therapy is tailored to each participant's individual needs and can include collaboration with families, support coordinators, and other providers. Participants can speak with our team about availability and suitable therapy goals.